Hello to everyone. In this video we'll be discussing the topic of myocardial infection. And first of all, myocardial infection is one of the most common diagnoses in the patients in the industrialized countries. So the patients who are hospitalized with the myocardial infections are actually uh, living in the countries which has most industries and most industrial population. So they are most prone to affect with the acute myocardial infection, and it occurs due to an acute lack of the oxygen due to the violation of its delivery to the heart muscle. So the main cause is that the heart muscle is not able to receive the appropriate blood supply, so which leads to the myocardial infarction. So myocardial infection is nothing, it is just like a injury to the myocardium of the heart. So what can be the now the causes of MI? As a result of erosion of the rupture of atherosclerotic plaque with formulation of blood clot or hemorrhage into the plaque. So the atherosclerotic plaque is a deposition of the fatty deposition around the blood vessel inside, and after later stage when it ruptures, it leads to the formation of blood clot inside the blood vessels, and that leads to the myocardial infection. So this can occur in the coronary artery, actually inside the heart, the blood vessel of the heart. Now due to the mismatch between the oxygen and the demand for it, like with a severe anemia or respiratory failure, so if the heart is not receiving appropriate oxygen demand or blood supply, then in that case there is chances of development of myocardial infarction. So that can be the case of anemia in which there is severe blood loss, and in the case of respiratory failure. Okay, now third point is the sudden cardiac death due to the uncertain level of troponin. If troponin level is not appropriate, muscles are not able to contract, and in which we can see changes in ACG to diagnose the levels of troponin, and autopsy can confirm the diagnosis of MI in this case if the cause is troponin level. Now fourth cause is the heart attack associated with the percutaneous coronary interventions if the patient has gone through stent thrombosis or recurrent blockage. And recurrent blockage can be due to the after the stenting there can be again blockage inside the blood vessel, which can further lead to myocardial infection. Now fifth point is the MI, which is associated with the treatment, that is a coronary artery bypass surgery. So in this case, if the patient has gone through the surgery, then again there is chances of development of MI in the patients due to the development of blockage in the coronary artery vessels. Now what are the risk factors? The patient who are prone or they have the chances of development of MI. The risk factors are like diabetes. The patient is suffering from diabetes and have the frequent habit of smoking, and suffering from hypertension, and there is high level of cholesterol, hyperlipidemia, high level of triglycerides in the blood vessels or in the blood, and the lifestyle is passive, very sedentary lifestyle, no active movement, no exercise. They are more prone, and diet is high in fat, person who are taking stress, and any family history with MI and sudden cardiac death in the past. And age can also matter. In the older age there is more chances of development of MI, and obesity is the main cause. And then if we consider in the gender, then the male are more prone as compared to the women's. So these are the risk factors. Now in the case of pregnant women, there is chances of development of MI, and it can be increased by 3 to 4 times if the woman is pregnant, and if he is going to develop MI, there is more chances as compared to the normal patient. Now frequency of this development is around 3 to 100 in the 1 lakh birth of the child. 3 to 100 is the chances, and 9% of the fetus are prone to mortality, and 11% are maternals who can be the case of mortality. Now pathogenesis of MI with the ST segment elevation. Now let's see one diagram. In this you can see this is a normal anatomy of the heart. These are the blood vessels, that is the left main coronary artery, right, this is your myocardium, okay, muscular covering, and these are your left anterior descending artery. And if there is any MI, so you can see this image, this is a blood vessel where you can see any clotting, blockage. So cause can differ, it can be atherosclerotic plaque, and these are the blood vessels. You can see the maximized image, you can see these are the plaques. So these are the occlusions which can lead to the insufficient blood supply to the heart, and that can lead to the large area of infarction and death of the myocardial tissue. So these are the progression of the plaque. This images you can see, this is a later stage, this is before that, and this is the starting. So this occurs inside the blood vessel in the case of MI. Now the pathogenesis of MI with the ST segment elevation. So ST segment elevation is in diagnosis in the case of ECG. We divide it STEMI and NSTEMI. So there are two pathologies in MI. And STEMI, the cause of STEMI is there is blood clot in the coronary artery at the site of the injury to the vessel, and this is due to atherosclerotic plaque. And STEMI may be precipitated by, after STEMI there can be chances of embolism, coronary spasm and congenital anomalies. Okay, so these are the case of STEMI. And NSTEMI is in which there is destructions of your heart cells, and this is caused not due to atherosclerotic plaque, it is caused due to imbalance between oxygen supply and its demand to the heart, and which leads to the partial occlusion of the vessel by the thrombus. And other causes for NSTEMI can be like mechanical obstruction any to the blood vessel, any trauma, chest trauma, that can lead to the obstruction to the blood vessel and further can lead to NSTEMI, that is non-ST elevation. So meaning of NSTEMI is there is no ST elevation in the ECG, you will see. And after second cause can be dynamic obstruction, which can due to coronary spasm, or the patient is suffering from angina like Prince methyl angina, okay, variant angina other name. Now increase in the myocardial oxygen demand, and which can be due to the increase in heart rate and increase in temperature. Now you see, if you see this diagram, mechanism of MI due to ruptured coronary artery is the clotting cascade. You can see this here. This is a normal vessel, and there is vasodilation after there is any atherosclerotic plaque. This is the body's sympathetic work which leads to the dilation of the vessel, and this is a clotting cascade. You can see this is left anterior descending artery inside the heart. Plaque is beginning to cascade, travel through the bloodstream, and there is a blocking to the distal portion of the artery. Okay, so this is the infarction here. So this is the main cause we will see in the case of MI, the death of the muscle tissue of the heart. Now there are one FAQs like frequently asked question, like can acute MI occur after chest or heart injury? Yes, there is chances due to any spasm, thrombosis or rupture or dissection of the arterial wall. And if we have to differ between acute coronary syndrome and how it is related to MI, so in MI we specifically see the ST segment elevation, and which is distinguished by your ACS. In ACS there is no such ST elevation in the ECG. Okay, now what are the statistics for NSTEMI? There are 10% cases there in which there is occlusion in the left main coronary artery, and 35% cases in 3 vessel stenosis, 20% in the 2 vessel stenosis, 20% again in the single vessel, and 15% patient have no coronary stenosis who are suffering from NSTEMI. Now this was the theory, and if we go to the treatment of this, we have coronary angiography with balloon angioplasty, in which we used to inflate the vessel with the balloon, and due to which there is dilation. And after that we can remove the plaque by depositing and expanding the arterial lumen. So inflammation is done in this case like balloon angioplasty. This is done through coronary angiography, and there is aorta coronary bypass surgery, in which we actually divert the pathway, in which we cut a occlusion site. Section of the vein is grafted actually from the other region of the leg. You can take the part of the vessel from the leg and just deposit in the heart, and that is called as coronary bypass surgery. So that will allow the normal blood flow. So this is a section of the vein grafted, harvested from the leg and used for bypass and allowing the blood to flow past the arterial occlusion. So you can see these are the vessels, and this is a damaged ventricular tissue. This is a posterior view, and there is a discoloration of the apical regions of interventricular septum. So these are the treatment which we do in the case of MI. Okay, so